We like to think of medicine as always being a rational, evidence-based march towards truth. But as a physician myself, I'm here to tell you that that's not always true. Sometimes medicine sprints confidently in the wrong direction. When groupthink takes over and even doctors stop using their critical thinking, bad things can happen. Now I want you to imagine the very essence of who you are, your soul, so to speak, being stripped away from you, and your body lives on as a shell of your former self, a fate truly worse than death. This was the fate of many people in the 1930s and 40s who underwent a procedure called lobotomy, a procedure that many of us know today as being truly barbaric and lacking in real evidence, was once the standard of care for severe psychiatric illness. This operation involved severing connections in the prefrontal cortex of the brain to relieve psychiatric symptoms. The procedure was considered a success if the patient came out on the other side docile and easy to manage. This was regardless of any personality changes or loss of what truly made them human. This procedure came about because psychiatry had a difficult problem that it couldn't solve in the early 20th century. People with severe psychiatric illness were starting to overcrowd mental institutions, and none of these psychiatric medications were really working. This, along with a poor understanding of neurobiology at the time, was the recipe of disaster that led to this procedure coming about. In the US, this procedure was popularized by Dr. Walter Freeman. He wasn't actually a trained surgeon, but a psychiatrist and neurologist who was inspired by the work of a Portuguese neurologist, Dr. Antonio Egas Muniz, who actually started his experimentation by drilling holes into patients' skulls and pouring in absolute alcohol to destroy the brain tissue within. This later evolved into a procedure called a leucotomy, where he used a special tool to remove frontal lobe tissue from the brain. Dr. Antonio Egas Muniz actually ended up winning the 1949 Nobel Prize in Physiology and Medicine for this exact procedure. In the US, Dr. Walter Freeman ended up partnering with a neurosurgeon named James W. Watts to perform the first lobotomy in America in 1936. This was performed on a patient named Alice Hood Hammett, who had been diagnosed with agitated depression. 6 days later, however, Alice started experiencing transient episodes of loss of speech, agitation, and disorientation. Dr. Walter Freeman started traveling throughout the US, performing the procedure on countless people. And in an attempt to make it even quicker, he developed the ice pick lobotomy, where he actually used an ice pick-like tool to disrupt that prefrontal cortex tissue. At times, Freeman was even able to perform 12 lobotomies in a single day, and sometimes even performing them on children, the youngest being only 4 years old. The media was also raving about it, calling it one of the most innovative procedures of the 20th century. Freeman had truly created a phenomenon and ignored the fact that many patients were left severely cognitively impaired, incontinent, and emotionally blunted, with many times this being the best case scenario. This procedure had a 14% mortality rate, with many patients dying from postoperative infection and hemorrhage. The truth is, lobotomies weren't healing patients. It was only making them more docile, more manageable, more convenient, at the cost of the very essence of who these people were. The ones who actually lived became watered down versions of themselves, but many unable to care for themselves at all, spending the rest of their lives institutionalized. One notable victim was Rosemary Kennedy, John F. Kennedy's sister, who underwent the procedure at only 23 years old. It's reported that Rosemary Kennedy struggled with mood outbursts and developmental delays during her childhood. Her family was worried about how this would reflect on her, how it would reflect on them. They signed her up to undergo this highly invasive procedure. During the procedure, Rosemary was reportedly awake, reciting poems to the nurses, while the doctors severed the very connections within her brain. They stopped when her speech deteriorated. At the end of it, Rosemary came out unable to speak, incontinent, and cognitively devastated. Who she was before had been completely destroyed, and she was left with not even the mental capacity of a young child. Rosemary, unfortunately, spent the rest of her life locked away in an institution. For many years, her condition was kept secret. No one really knew what had happened to her. Rosemary ended up dying of natural causes in 2005 at the age of 86. But I'd argue that the real Rosemary Kennedy died on that table at the age of 23. Truly, it was a tragedy, simply because she was inconvenient to those around her. The medical community allowed this barbaric procedure to go on for 2 decades. It was popularized. They promoted it, despite a huge lack in evidence and a high number of patients being harmed. And lobotomies didn't disappear because the medical community suddenly decided it was unethical. They stopped doing lobotomies because they had finally come out with an antipsychotic drug that worked, chlorpromazine. So it wasn't a change of conscience, a change in evidence that swayed the medical community, but simply a more convenient, quicker option to get the desired effect of a docile and easily manageable patient. The history of lobotomies demonstrates how groupthink in the medical community can override critical judgment and the core principle to medicine of first, do no harm. This should serve as a cautionary tale of what can happen when social contagion and authority bias run rampant and real people end up getting hurt. People like Alice Hood Hammett and Rosemary Kennedy and countless others who were permanently altered, being severely mentally ill, being misunderstood, and being inconvenient.